Welcome to the Longevity Protocol with Dr. Cristina Bosch and Dr. John A. Robinson. We'll be your guides to uncovering the secrets to optimal health, better sex, and happiness. From debunking aging myths to exploring the science behind what it means to live the Longevity Protocol, we'll dive into a wide range of topics. So, get ready for an exhilarating journey in what it means to live well and feel your very best at any age. Is sexual dysfunction all in your mind, or is it all in your body? A lot of patients ask this question. There's a lot of assumptions out there about it one way or the other. I want to remind everyone that we just did a really fantastic episode last time about penis size, and we wound up getting into a lot of understandings about sexual satisfaction for men, particularly women, what makes women orgasm. And so now we're going to get a little bit more specific about sexual dysfunction and where is that lying? Is it in our body or not? Is it all in our mind? Is it both? I mean, but really, what is it? But before we start, I think what's even more important to make sure we're clarifying, particularly for those that are watching on YouTube, that I want to make sure that I'm saying very clearly that this is a beautiful dress you have on.
Thank you. And it
is the prettiest color of orange I've ever seen.
You are so special.
This is an orange dress. I want all that are watching, I want people to comment.
I think we can
want
take
to hear
a poll
from the guys.
We can take a poll.
This is an orange dress.
Is this a reddish orange?
Or is it orange? It maybe has some red in it.
Is it an orangey red?
Or is it just an orange?
It is a pretty dress though, isn't it?
It's beautiful.
Thank you.
I think guys just kind of are a little bit more basic about that. I mean, orange.
And orange is more basic than red?
No, meaning just like, I don't know, it's just orange. When it's red, it's red. When it's orange, it's orange.
I see.
Right now, it's orange.
It's red.
Okay. Either way, it's beautiful, just like you.
Thank you very much. Yes, it's a pretty dress. Thank you.
We're going to answer some questions today. And as we usually do, are sexual issues in your mind or in the body? Is it both?
Of course.
What is female sexual dysfunction? We really want to get now more specific because we have to define what all these problems are for men and women. How common is female sexual dysfunction? How does a guy determine if he has erectile dysfunction? And then to what level? Is it mild? Is it moderate? Is it severe? What makes couples sexually dissatisfied? And we'll talk about obviously about satisfaction, but what's the thing that sort of gets in the way that leads into their dissatisfaction? And what is sexual optimization? This is a term that you and I have coined. We're talking about this, sexual optimization. I love that term. And we're going to talk about that today and how we define that just in general. So, and then of course, what are the treatments for sexual dysfunction in women? And interestingly, I know I just said that, but we're not going to get into the treatments. Just like when we talked about penis size and we got into all these other things on that last episode, we didn't really talk about, well, what are the solutions?
Right.
And in this particular episode, sorry guys, we're not going to get into the solutions, but in the next episode, we will.
We will.
So we're really pulling it all together.
You know, I'm glad we're doing this issue because when I think about the issue that we did on penis size, I think, isn't it so funny that it was an entire episode about penis size and really all we talked about was women's sexual satisfaction.
It was a lot of that, wasn't it?
What is the conclusion? So hopefully in this episode, we will decide, is the conclusion that men basically have no bar of sexual dissatisfaction? They just are sexually satisfied? I don't think that's true.
No, I just think that because we were focusing on guys, what we're all finding about sexual satisfaction with partners, so maybe I'm letting the cat out of the bag kind of soon here, that it's this mutual desire, that a desire for the other partner's satisfaction. So when we're talking about guys and why they do what they do, in the end, it's all for women. That's why they do what they do. It's all for their sexual partner. That's why they do what they do.
I see. So if we were to stop talking right now and not do the episode, we can finish with the conclusion that as long as a woman is having a good time, the guy will have a good time.
That is the massive bulk of it. Because I've had patients, now that you're saying that, I don't think we mentioned this on the last episode.
That's assuming they're in a happy relationship.
Yes. Yes.
Okay.
And I would say most of my patients, when they come in, they generally are. I'd say generally they're in a happy enough relationship. But I have had many women come to me in a, let's say, a level of distress about their need to get an orgasm because they said, my husband will be extremely upset. He is always upset
Oh, yes.
when I don't have an orgasm. I can't just have sex without it. I got to have an orgasm.
Yes.
It's got, I've got to say that was
I've
to the
had
moon.
that
It was the best thing.
conversation a lot.
Yeah. And so it puts a lot of pressure on women. So they come seeking because they're like, hey, every time I can't.
Right.
And so it makes it more difficult if we're only dealing with the female, but we can, of course, help her. But a lot of times it's about, we try to really encourage the guy to come in so where we can see what's going on with him. We talked very clearly that at least when it comes to vaginal orgasms, there is a level of need to a degree of length of penis for that if women are actually wanting that. But, they don't have to have vaginal orgasms. They can have clitoral orgasms, and that doesn't matter as much. But it depends on what the couple's wanting, and you don't know until everybody kind of comes in and talks about it openly and is willing then to do something about it. Because sometimes I've seen them where the guy's like, I don't want to do anything about it. She's got to fix herself. And I've seen it vice versa.
Right. And I would also like to offer for men that women are not lying when they say, or I should say women aren't always lying. When a woman says, that was great sex and I did an orgasm and it was still so incredibly satisfying, like believe them.
Yeah.
Believe them. I don't think women always want or need or have the ability to orgasm.
Yes. I think that's extremely important. And that always comes back to what we say is what is the best way to figure all this out? It's through communication and really being open and honest about all of this. But I will just tell you, a lot of guys don't think about it that way, and they can really get some things stuck in their heads about what sex should be. And that's the other thing too. I think it's amazing to see how couples, whether we're talking about nutrition and how they can get really like focused in on a very small, narrow-minded approach to nutrition, they can get quite narrow in the perspectives of sex and say, no, this is the way it is. It's either what they were taught or what they experienced in the past, and they can't open up beyond that.
Yeah.
And so that takes conversation, again, willingness, communication.
Mm-hmm.
There's something called the, well, first of all, I think a lot of guys, and maybe even women, but let's say particularly guys, I'm going to talk to guys now. My mentor, Dan Pena, and if you don't know who he is, I always encourage people to look him up. I'm very, very fortunate to say that he's my mentor. I'm in business with him. He's this eccentric multimillionaire. He lives in Guthrie Castle in Edinburgh, just outside of Edinburgh in Scotland. He says a stiff drink and a strong screw will kill most of you.
Good way to die.
Yeah, it's a good way to die. Although from his perspective, like, come on, you guys need to.
The point is they can't hang.
They can't hang. Sort of man up. A stiff drink and a strong screw. But yeah, I think he's trying to say that a lot of these things are that it's in our minds. That it is just our perspective that we would be able to push through and have a really good sexual encounter if we wanted to. And that's what I think is really important. So a lot of it really is maybe perhaps in your mind, at least there's a perspective from good old Dan Pena that maybe a lot of the sexual issues might be in our mind. But is that true?
Well, I think a lot of things are in our mind. The notion of hangups, like people have so many hangups and they're so concerned. It seems to me that we live in a society that is very greatly concerned with what the outside world thinks of them, even people they don't know, right? And that makes a world of a facade. If everything is a facade, then the depth that is necessary for good quality sex, that reckless abandonment, that ability for passion, that ability for throes, that's got to go more than skin deep. So get that crap out of your head. Like it doesn't matter what the people around you are thinking. It matters what do you think about yourself. It matters what does your partner think about you, and what do you think about yourselves as a couple? Well,
as you're saying that, again, these are things that we can talk about too, because it's part of the topic today, is self-esteem. I mean, that has self-esteem, body self-esteem has a whole lot to do with why men or women are going to have a better sexual response and sexual satisfaction. So self-esteem in the end, again, we're talking about Dan Pena. He would say many things in the world come down to that. He's quoted in saying about, I'm maybe a little bit getting off of tangent or going on a tangent here, but that political correctness is a manifestation of the world's lack of self-esteem. And so we see this sort of across the board, is that, a lot of maybe the issues that I think the pendulum is swinging in terms of people are waking up again. And maybe the pendulum needed to swing in the direction that it did. And maybe now it's coming back. Maybe that's just the way society evolves. But ultimately, there needs to be this idea of self-esteem, and we need to.
Yeah, but political correctness is exactly what I'm referring to. It's this exaggerated concern about what a stranger thinks. If you are speaking we're definitely going on a tangent, but so what? If you're speaking your truths, if you're a person of honor and your word is your word and it can be trusted, just speak well, speak honestly. The rest of it doesn't matter because you're speaking with integrity, even if it is an insult or a criticism. I definitely would agree with that. I feel like we have this ridiculous distortion of what other people think about us, when half the time they're not even thinking about us. Half the time they're looking at you thinking about how you make them feel about themselves, So it's hard to have a good time. It's hard to be sexual and sensual when you're so concerned about, again, facades.
Okay. Now, when it comes to this idea, is it all in your mind or is it all in your body? There's actually an approach with this in science, and we're not just talking about sexual dysfunction, but really almost anything. And it's called the Manichean approach. And the Manichean approach in science would suggest that, let's say, sexual dysfunctions are either caused by a physical, biological issue, or they're caused by a psychological. It is an either-or situation. And often medicine, certainly conventional approaches and how they like to put everything in a box, they're saying that this is an either-or situation, that it can't be both. It's one or the other. And obviously, by your expression there, and certainly our experience, that is just not true.
Well, I would agree that it's the cause perhaps is one or the other, but the cause is just a thing that starts it, sure. Right? And then you get this negative snowball effect.
Yeah, that's chicken or egg there, and then they're both involved. Absolutely.
So you have to kind of tease that out and figure out what to do.
You have to tease it out, and then you have to approach both sides of it.
And treat the cause.
Yeah, absolutely. I mean, a lot of times, look, we can, let's say with some erectile dysfunction, you can help a guy pretty straightforward with that. It doesn't mean that we have to sit there and go through a whole, psychological assessment about it at all. We just, we fix it. But when guys, and then when you have a relationship with a patient, they keep coming back and they're saying, well, it's not working as good or whatever. And we have that opportunity because what we offer patients is time. We ask questions, then maybe we can get into those other things and see how we can put that all together to get the best result.
Yeah, like if a person's true root cause is mental, what were the two choices, physical or mental, or what was it?
Well, yeah, it's either a physical biological issue or it is a mental emotional issue.
So let's pretend that the guy has ED and it's at its core a psychological and emotional issue. And they come into the office and they get an injection of something like the Trimex, where they get an injection into the penis, right?
Yes.
That causes pretty instantaneous erection.
98% of the time.
Okay.
Correct, yes.
That in and of itself is going to be, that's a biological, physiological addressing of the issue. But that in and of itself, that ability to see that erection come right away has got to do so much in dismantling psychological barriers.
Absolutely. And a sense of confidence, again, just knowing that there's an answer. Right. We've had men like in tears in the office having an erection for the first time in literally decades.
Yeah, that's
something. It is profound. And sometimes that's just what they need. But ultimately there it was, a physiological thing, but it helped them mentally and emotionally. And so it all is intertwined. I just do not understand how to separate it out. I mean, I think it talk about a sense of voodoo to be able to try to separate out when we are mental, emotional, physical beings, and we try to separate those things into their own box. Yeah. I mean, that sounds sort of insane to me. With all that said, it maybe helps us to narrow in on treating one thing or the other.
I think the process of teasing out is really about palliative symptom addressing. It's not about treating a cause. So ironically, this is talking about treating the cause, and there's only a cause. But when you take that approach and you don't look at it as a dual system, then you're less successful at treating the cause. So I would say if you're looking at symptoms individually, then you're going to have much more success for palliative symptom relief at the moment, but you're very rarely going to get to true permanent change.
Fully agreed. So there's some controversies in even defining what is normal sexual dysfunction, but particularly for women. Some researchers and clinicians, they will actually argue that the prevalence of female sexual dysfunction, MSD, is usually high, and they think it's kind of exaggerated, that potentially leads to what they would say unnecessary medicalization or unnecessary treatments. And I don't think we at all see it that way. But the number is 43%. So that is a very common number that's out there. So almost half of women having some form of female sexual dysfunction. And I think, again, when we're looking at it, just to say we're going to medicalize that, we're only going to get to the point of treating it full blown, then maybe that is what they're thinking, and why that might be exaggerated. Mm-hmm. But on the other side of that, I think a lot of women are incredibly underserved. We've talked certainly about the Women's Health Initiative and hormone replacement therapy for women, that there was essentially an entire generation of women that were kept off of hormone replacement therapy that otherwise they should have been on, because the concerns of breast cancer and all of that were massively overinflated. And it was really just propaganda is what it was.
Right.
And that led to all kinds of problems with female sexual dysfunction for women that they otherwise didn't have to suffer.
Yeah, I don't think there's anything unbelievable about saying that 50% of females might have some level of sexual dysfunction, or at minimum sexual dissatisfaction.
Yeah. And then they say the medicalization, so it depends on what we mean by that.
If giving hormones is considered medical intervention, then, God bless, do it.
Right.
Get in there.
And we don't see that as something that is an overly invasive kind of thing. In fact, if anything, it's usually a foundational approach to all kinds of things.
Right, it's causative, right.
Yeah, and it's not just about their sexual function, but many, many other things. So why not have that there?
And medical intervention might help prevent getting to the point of sexual dysfunction. Mm-hmm. Like if you're feeling sexually dissatisfied and you get it treated or you get it addressed quickly, then it should spare you getting into a state of dysfunction.
I think it's important to talk about what female sexual dysfunction is in terms
distress.
of distress. Yes. So what really is it? So if you're sitting there, you're listening right now.
Go get paper, go get pen.
Yeah. I mean, really think about this one.
Okay.
Again, all of these symptoms, it's going to be on Substack as well. But listen in and see if maybe this resonates in any way. Female sexual dysfunction is defined as having at least one of the following: a problem with desire, like I want to, psychological desire, arousal, lubrication. That's kind of back to the hormone thing to some degree. Having an orgasm or not. In our last episode, we actually discussed that for female sexual satisfaction, that orgasm is usually part of, it has to be within the mix there most of the time.
I'm sorry, baby.
Having actual satisfaction, number 5. And then whether or not they have pain. And pain certainly winds up affecting all these other things above: desire, arousal, lubrication.
Of course.
Yeah, I mean, pain is amazing on how that just shuts it all down.
Mm-hmm.
So again,
and
desire.
This is talking about pain and intercourse.
Yes.
It's not talking about general pain.
Because
I do think there's a lot of general pain, even in young, healthy people, that will also completely smother sexual desire.
So if you even have one of those issues, we can now say there's, FSD. Would be a diagnosis. Now, FSD, or female sexual dysfunction, then has other things sort of underneath that umbrella. In other words, you can get more granular, you get more specific. So we can then say female sexual distress scale. So now again, pen and paper, listen in. This is ranking from 0. The symptoms I'm getting ready to read never happen, all the way up to 4, which would be always. So always. 0, 1, 2, 3, 4, up in that grading all the way up, 4 would be always. Number 1, you're distressed about your sex life. You're unhappy about your sexual relationship. You're guilty about sexual difficulties. We see that a lot with women. They come in, they feel really guilty about it. Guys too, but really women. Frustrated by your sexual problems. Are you stressed about sex? Feeling inferior because of sexual problems? Worried about sex? Sexually inadequate? Regrets about your sexuality? Embarrassed about sexual problems? Dissatisfied with your sex life? Angry about your sex life? And bothered by low sexual desire? Now, a lot of those always sort of sound the same, but they create these tools in a specific way. The wording is somewhat different, and it has different weights and meanings for people, so it helps to really dial in for these diagnoses. But so if you have female sexual distress, that would be a score of greater than 11 on that. So as you went through those 13 things.
Greater than or equal to 11.
Yes.
Okay.
So getting even a little bit more granular, female sexual interest arousal disorder, FSIAD. So a woman must experience persistent or recurrent difficulties with at least one of these following. There's 3 of them. Number 1, lack of or decreased sexual interest, like a decrease in sexual thoughts, fantasies, a desire for sexual activity. Number 2, a lack or decreased sexual arousal. Again, vaginal lubrication, swelling, any other sort of physical response to sexual stimulation. And number 3, a lack of or decreased sexual excitement or pleasure, a lack or decrease in the subjective feelings of sexual excitement during sexual activity. So any of those 3 things. So that is something that one sees quite a bit in medical practice.
I think those 3 are very good distinctions when a female is assessing herself. Because people will say, I have low libido. I have low libido. And I don't know that they always have low libido. Mm-hmm. I think that if you're looking at these 3 categories, like a lack of decreased sexual interest, a lack of or a decrease in sexual thoughts, fantasies, or desires, you say, I have low libido. But then I ask them, okay, but once you get started, how is it? Are you able to orgasm? Right. Do you get into it? Are you able to have lubricate? Do you find that you get lubricated, etc.? I don't know that for the average female, not thinking about sex as much as they used to means they have low libido. I know I'm shocking you. I'm not really sure I've ever said that to you. But I really do think, and this is something we talk about actually quite a bit when we're referencing other patients or just readings, etc. I think that a lot of women, especially women that have still children in the home, like maybe not older patients, they have a gazillion things in their head. You've mentioned it before. We've laughed about it. The man can be doing anything. The kids can be running around the house with, scissors, and they're no problem. They're good to go. But most women aren't. So is that really low libido, or is it just they don't have the space to allow libido to be driving them towards sex versus other responsibilities?
I think women, I hear you. I think most women actually have this flow. It's there. The libido is there, but it's blocked through these psychological barriers. Again, the concerns they have throughout the day, taking care of the kids, whatever it might be. But it is actually there, but it's blocked.
So the point is, if you're noticing a decrease in your thoughts, fantasies, sexual activity, you have to figure out whether or not this is a true female sexual dysfunction, like my hormones are low, or I have an ovarian cyst and there's pain with intercourse. Like, you've got to go through the process of figuring that out. Because if it's not a physiologic issue, then it still merits a conversation on how to do better at introducing more sex into your life so that you have couple satisfaction.
Right. And getting rid of some of those barriers. I mean, we're back to the barrier concept, that there might be those, if you can talk it through, you can figure out what those things are and improve that.
Okay.
All right. So that's the ladies. Let's move on to the guys and talk just in general about erectile dysfunction. What does that mean for guys? It's also relatively straightforward. So guys, or women, if you're thinking about your male partner, rank these from 1 to 5. 1 is very low, 5 all the way up to very high. So again, you've got to grade it 1, 2, 3, 4, 5. 1 is very low, 5 is very high. Number 1, how do you rate your confidence that you could get and keep an erection? Number 2, when you had erections with sexual stimulation, how often were your erections hard enough for penetration or entering your partner? That's a really key question. During sexual intercourse, how often were you able to maintain your erection after you've penetrated? Also, another really key distinguishing uh, symptom for guys. Number 4, during sexual intercourse, how difficult was it to maintain your erection to completion of intercourse?
And that means ejaculation.
Yes. Number 5, when you attempted sexual intercourse, how often was it satisfactory to you? So, depending on how you answered there with that, the score of just 1 through 7, meaning very low, because you would say you're answering very low to all of those things I said, that would be considered severe erectile dysfunction. So from severe, 8 through 11 is moderate, 12 to 16, mild to moderate, 17 to 21, mild, and then anything above 22, there's really no signs of erectile dysfunction. So, but that idea that, back to what you were saying before, I think you just really have to talk to patients and really understand what does libido mean? Libido means, if you just say that broad word to a patient, it means so many things in their mind. Or I'll say to a female patient, do you have vaginal dryness? And she'll say yes. But what I'm looking for, and what she actually meant, and many times I have to ask, she meant, well, she's not getting lubricated as much during the sexual stimulation process. When I was actually asking, or if you're sitting there right now in front of me, do you have vaginal dryness? Meaning all the time. And they go, oh, no, not that. I just, I'm expecting more lubrication at the time of stimulation. That's really what they meant by, quote, vaginal dryness.
Right.
But that's not clinically, we would all call that vaginal dryness. So you have to really ask questions and really just, again, it's about having that relationship with the patient to be able to dig into these things. So the same thing for guys. I mean, we just have to understand where, you got to go through and ask these questions and be frank about it and be honest about it.
Well, and that's what's so important about these kinds of episodes. I think this is why people are so interested in the podcast world. You're getting educated on what these definitions really are. So then you're not so nervous. You're not so scared. You're not so self-judgy. Like, oh, I don't actually have erectile dysfunction. Yeah. I'm just not where I want to be. Okay, then let's shoot for sexual optimization.
Yes.
But the minute you can self-diagnose and say, oh, maybe my libido isn't that low. Maybe I just need some tricks and some tools on how to get back to a place of initiating sex more often. Oh, okay, let's take some of that weight off of our shoulders, right?
Yeah, a lot of times just engagement and treatment. I mean, guys come in, let's say, with just mild ED and a couple of tweaks and twists and what we're doing, some testosterone, some other basic things with nitric oxide, and just that it's gone. That any thoughts in their mind about any type of definition of erectile dysfunction is wiped out very, very quickly, very, very easily. So just know that, again, early treatment, early discussion is the way to go. A lot of guys also deal with premature ejaculation. And this is this is a growing phenomena as well. And it's actually the most common sexual dysfunction in men, more so than even erectile dysfunction, reaching up to about 75% of guys. And let's define this. What exactly does that mean? This is having an ejaculation in 1 minute or less. That's number one. It's also a persistent and recurring pattern. It's not just one time it happened or whatever. It can't be just only a one-off. It pretty much is always about a minute or so, and that's it. You're having the ejaculation. But here's the other big thing about this and why maybe it doesn't always get discussed. In order to have the diagnosis, technically, you would have to be dissatisfied with that. So it's 1 minute or less, and then maybe every once in a while, you have guys go, I don't know, that's just the way it was, and
I'm fine with that.
I'm fine, and I think she's okay with that. Or maybe she is. Maybe she is, and maybe because they don't know how good it could be. And I would think that in general, people wouldn't be good with that. But it's just you have to actually feel some kind of dissatisfaction with it. Then at that point, we would say, pee.
We've sorry, go ahead. You would say, okay.
Yeah.
We have also talked about this idea of foreplay. I mean, if you are starting to experience, if you're a male who's starting to notice, I am ejaculating sooner than before, then it's that much more important that you really work at getting your female partner aroused so that you can have an orgasm at a more similar time. Because the average length of sex is what, 7 minutes? Isn't it something really short like that?
No.
Yeah.
Was it that? I thought it was closer to 18, 19 minutes.
No,
was the average.
Like Okay, we'll get back to you on those stats because I thought
It's somewhere between 10 and 20 minutes.
I thought that I thought it was one of those like shocking, like the average amount of time it takes to ejaculate is 7 minutes.
Maybe I just always push that out of my mind as a possibility. But
I think what you're referencing is that when people are having like a session, that it's usually 20 minutes.
It's about 20. It's something. Yeah, it's roughly around 20.
So 7 minutes. Can you hang out for 7 minutes? Well, it'll be a lot easier to say, well, I can only hang out for 4 minutes before I ejaculate, but we had such a wonderful
the whole thing.
Pre-penetration session that it's still quite satisfying.
Yeah. And hopefully that is the case. But, and I want to remind everyone, so we're not really going to talk too much about treatment right now.
Yeah.
And there's treatments for this, guys.
Oh, yeah.
But that's in the next episode, and we're going to get more specific about treatments for this.
Okay.
So is it all in your mind or what? I
don't know. It's both.
A little bit of both. Yeah. It's a little bit of both. What makes a woman sexually satisfied now?
Mostly in her mind.
I think so. We talked about this. Actually, we mentioned this in the last episode, but I think it's worthy stating this again. 2008 study. The most important determinants for sexual satisfaction for women were, number one, to feel desired for their partner. To feel desire for their partner. Yes. Mm-hmm. And it's reciprocal. Women want to feel desired. When they feel desired, it really, really makes a big difference for them. To receive attention from the partner. And that's that desire. And then they're able to also satisfy their partner. A lot of times, just as much as it is for men, women will say the same thing, that they want to know he was satisfied. And that makes them then sexually satisfied. So really, it's both the partners, fortunately, I think, are actually looking out for one another. And that's thing that makes them sexually satisfied. Correct. I agree with that. And that less significant were all the physical sexual factors that we would think to feel sexual desire, to have physical pleasure, to feel physical excitement. The physical things were less for that. Right. And again, as we had said in the last episode, it's not necessarily about masturbation. Is masturbation the key to enhance, like more masturbation, more orgasms on your own? Is that the way to enhance your sexual satisfaction with your partner? And generally the answer is no. It's not going to make that difference. We talked before about the idea of, helping to explore if you're having female sexual dysfunction, these kinds of things. So you're trying to figure out, is this a physiological problem or where it's sort of coming from? But we're saying, all things being equal, I'm just going to masturbate more in order to improve my satisfaction with my partner. It just doesn't work. Doesn't happen. No. Yeah. If anything, sometimes I think there's a threat where the person will say, might as well just masturbate and not have a relationship then, because this is more satisfactory. And that, I think that's a big part of the problem. Yeah. Okay. Which sucks. So sexual satisfaction in couples. Dissatisfaction, yeah. Excuse me, sexual dissatisfaction. Mm-hmm. So I said earlier we were going to answer that question. Here's a study from Archives of Sexual Behavior. This is actually an older study from 1983. 45 couples were seeking sex therapy. And for guys, the most common complaint involved too infrequent intercourse. They just wanted more sex. Then it was followed by the failure of their partner to reach orgasm. There it is again. So guys want to know that she's reaching orgasm, and a concern with their own sexual adequacy. Again, some guys' personal self-esteem about their potency and their ability to perform and help her to achieve orgasm. So I have a real problem with this, and I always talk about this. I feel like this is men being so obnoxious. Like, your primary complaint is that your woman doesn't want to have sex enough. She doesn't initiate enough. There's not enough frequency of sex in your life. Mm-hmm. But right on the heels of that she doesn't orgasm. And I'm trying to say, if you want to have sex more often, you got to let go of the notion that she has got to orgasm each time. Orgasming is an expenditure of energy. It's like whoosh, right? It's this combustion. And again, I'm not talking about teenagers and people in their early 20s, and I'm not talking about retired senior citizens or just retired folk. I'm talking about the people in the middle. When you don't have that much energy because you have so many things on your plate and your partner wants more sex, sometimes it just has to be sex so that your partner can orgasm. Mm-hmm. And it's good. You maintain that closeness. You have that skin to skin connection. You have that
opportunity to just focus on each other, but you don't have the exhaustion of an orgasm.
Mhm.
So
and the pressure of it.
And the pressure of it. So I feel like I feel like men really kind of gotta, get that in check a little bit. Just be okay with your woman wanting to be with you so you can have the frequency of orgasm that you want.
Yeah, I'm thinking about that if there is the actual physical, neurological response of an orgasm, endorphins, all the things that occur hormonally. But then there's just an orgasm for life, that through the process, there was such a connection that she felt satisfied.
Right.
And that the guy is recognizing that. So one, it's up to the woman to express that.
Yeah, to make it clear that that was that.
That was like, that was fantastic. Yeah. And I desire you. And that's where I think guys would probably, okay, I'll take that as a reasonable second to the whole thing, and then be satisfied with that response.
Right.
So again, it always takes two to tango there.
Uh-huh. Okay.
So for women, for their levels of sexual dissatisfaction, for women, complaints involve difficulty with becoming sexually aroused, being able to get to that point, getting rid of some of those obstacles that we say. The flow is there, but there's obstacles.
Mm-hmm.
Or they're reaching orgasm, because again, still that is a concern for women. They want to orgasm. And concerns regarding their own sexual adequacy. We're right back to the concept of self-esteem. And, you're feeling like, I'm measuring up here. So both men and women are having similar hangups about that. So for both sexes, the incidence of specific sexual dysfunctions were considerably lower than for more general interpersonal difficulties. Important determinants of sexual distress include the partner's lack of response to sexual requests, infrequent intercourse, lack of affection for the partner, and the absence of specific sexual dysfunctions in oneself. So,
right. And infrequent intercourse, which I think is the thing we see the most. I would say it's the thing we see the most. People are saying we don't have sex enough. I think I hear that way more from the men and the women than I hear all the other stuff. Now, again, I don't work with men. So I imagine the women, most of my women that are complaining about infrequent sex have a partner that is perhaps dealing with ED.
Yes.
Okay. So then that's a whole nother chapter. That's like Robinson, you, and everybody else. But this idea of infrequent intercourse is also really for the couple to decide what it is up to a certain limit. Couples would say, well, we have sex one time a month and we're both okay with that. I don't think that that's good. I think that allows there to be too much disconnect as a romantic unit, really just as a unit, mm-hmm. right? But the average amount of intercourse
once a week
is
it's roughly 50 or so sexual experiences per year. It's about once a week.
Once a week. Yeah. And there are so many pop culture pieces out there that will tell you that it's 3 times a week. That's not true. I don't know. But that's not true, is what I was saying. That 3 times a week is not true. That's not what most people are doing.
And I still think, look, I mean, I always want to, if it is good quality and you have the ability to have good quality more than once a week, I still think that could be beneficial. If somebody can achieve that.
I think 3 times is a good number to shoot for. Mm-hmm. It's what I talk about with my workouts. I'm like, shoot for 3 times a week. So that if something comes up, I at least got in 2 good weight resistance exercises, right? Yeah. So same thing for your sex. Like shoot for 3 times a week so that if one falls away, you at least had 2 good orgasms in the week. And then perhaps you start to sprinkle in some of those, we didn't orgasm, but we had fun moments.
Yeah.
Okay.
Nothing wrong with a quickie. So what makes a man sexually satisfied? And being able to perform is right at the top of the list. And part of that, and I wanted to emphasize this, feeling minimal pressure. Because the guys that I talk to and they come in and they start opening up about all of this, they feel the pressure of the whole thing. You can see that men want to perform in general in life.
They want to provide.
Yeah, they want to provide. And they already are heaping a lot of pressure and responsibility themselves. They already have, whether they're heaping it on themselves or not, it's already there. And then now they just get concerned, or I failed that one time, and that one time is stuck in their head. And then that leads into having an issue the next time they go for it. And so I think what's important here I mean, guys need to understand that they need to try to take the pressure off themselves, but this is where the partner comes into play, to really try not to put the pressure on there. Yeah, not make that worse, and be good about what's going on because of that just general contact. Take the pressure off the whole thing. And then once you do that, the pot will boil. Again, knowing that she's satisfied, the same thing we've been saying, communication and connection. If she expresses pleasure during sex, men are more sexually satisfied. And so do not be a passive participant. And I've had guys come in and sort of talk about that. It just depends on how she's involved. And she might not be super involved. That's maybe they have certain hangups about it. Maybe they're actually in pain. Maybe they're having their own problems that need to be addressed too. But don't be an inactive participant. Make sure you're expressing them. We're right back to communication, even during sexual intercourse.
And I also think a good tip for women as a partner is to just make sure you practice variety. Like, really focus on letting yourself be different each time that you're having intercourse, that you're having sex with your partner. Think about it. Sometimes you're quiet, sometimes you're vocal, sometimes your vocal cues are loud, quiet, laughing, intense, whatever. Just, you will be surprised how the facial gestures and the voice commands actually, your body will respond to them. Just like when they say when you're talking on the phone, if you smile while you're talking, your voice translates as more cheery. It's the same thing when you're having sex. Like, women really do. You should try to let your partner know what you're feeling, but express that in different ways. It's going to make it much more interesting because men tend to want variety in their intimacy.
Yes.
Not variety in the partner, variety in the styles.
Yeah, the style, the whole experience itself.
See, there you go. Variety and exploration.
Yes. Well done. I wanted to mention this. I'm going to skip around a little bit here. That the results that were highlighted in this particular study, that mutual pleasure is a crucial component for sexual satisfaction. We just got done saying that.
Yeah.
And that sexual satisfaction derives from positive sexual experiences and not from the absence of conflict or dysfunction. In other words, it was whether or not they were fighting, whether or not there was those issues, was actually not that important, and it was independent to that. And that's a good thing. We always talk about that, arguing well, knowing that there's going to be conflict within the relationship, and that shouldn't shut things down sexually. Or any aspect of the relationship at all.
Of course. I mean, one thing we never talk about is the idea of negative passion, which exists. There's no place for that in these conversations. That's not what we're talking about. We're not talking about like dysfunctional, toxic relationships that are so toxic and intense when they fight, but then they're toxic and intense when they have sex, and then the sex is great. That's not what we're referencing. We're talking about things like we argued, but we argued well, and then we had makeup sex, or we're both stressed, we're arguing a little bit more, but we can always come back together to just like unwind and reconnect and just let the crap of the world disappear for a minute. That's what that means.
Yeah. And it seems that generally speaking, that's what most people are thinking. That's what's
true. Yeah. Okay.
Okay. So this was a fun one. Predictors of sexual satisfaction. This was an international study. So they were looking at, I think it was about 4 or 5 different countries. They found statistically significant higher satisfaction among, this is for our homosexual patients out there and listeners, that actually there was higher satisfaction among homosexual individuals, participants between 18 and 23. So kind of what you were saying a little bit earlier, that, a lot of times you're just younger. You're just generally more satisfied with sex.
Well, you have less on your plate usually.
Less on your plate. It's more novel. You're having fun. And those with a higher level of education, they're also with a current sexual partner, and they are in some kind of partnered, even unmarried relationship, with 11 or more sexual contacts per month. So now we're that frequency of roughly, there you are, 3 times a week. And they didn't have any diagnosed mental and sexual disorder.
Of course. So those were different things. That wasn't homosexuals that happened to be in the age of this with high. No, these are the categories of people that tend to be more satisfied.
Yes.
So homosexual individuals, and I do believe that that's more true for homosexual males than females. I think homosexual males are profoundly more satisfied in their
in their relationships.
In their
Yes. Well,
relationships.
and we've talked about this stat, and
Yeah.
I'll bring it up again, that basically homosexual men have the lowest divorce rates.
Yeah.
Yeah. That they will, and lesbian women have the highest, and heterosexuals are kind of somewhere there in the middle.
Mm-hmm.
So I think what was important about this, I just think it's really profound for our work, because we mostly deal with heterosexual married couples. They're usually above 40. So it's, they're not necessarily the sort of the young, carefree type of approach in their lives. And that's why our work is important, because we want to work with those people that really in the end are tending to have the most issues with these things anyway.
True, but that age group is also the age group of people that are like, this is the best era of my life.
It should be, absolutely.
It's like I punched the clock.
Yeah.
I worked. I tilled the soil. Now I'm
in the relationship. We know each other well.
That's right.
Yes.
Now it's just like harvest all year long and fabulo. So that's why we're talking about this, because if you're in that era and you're like, no, the partner's right. This is good. What else do I need to do?
Yeah.
Okay.
And this is a good way to end, so we can talk about this idea of sexual optimization.
Yeah.
And this is definitely the sex docs approach.
Yeah.
This is the approach that we do in all of our practices medically. It's similar to the idea of hormone optimization. And that's a better term. We see here hormone replacement therapy, but hormone optimization means maybe it's still in the quote unquote normal range, but we're really going to optimize this in terms of ranges and prescribing it and using those tools to optimize the health.
And the other reason I love the word optimization is because it kind of references back to what I was saying at the beginning of this episode. We're not having good sex because we're comparing ourselves to the Joneses. That's not what this is about. Optimization is all about individualization. It's such a wonderful way to approach health and wellness. It's not about what the trend is saying. It's not about what the fad is saying. It's not about anything other than what do you want for yourself and how do you keep pushing that desire and the ability to meet that desire so that you're greater and greater and greater each year.
Yes. And part of this sexual optimization, that's really well said. And part of this sexual optimization would be taking action, having intervention early on. Looking at some of the hormones would be part of sexual optimization, making sure, that's to us the foundation of virtually all of it. But that there's certain treatments, O shots, P shots, things we've talked about and things we're going to talk about in the next episode that we'll get into the treatments. But know that that's how we should be looking at this. That whether we're talking about sexual optimization, hormone optimization, anything with health, we should look to optimize and be bold to take action for the sake of the patient early on.
That's right. Like you said, we're the sex docs. Why are we the sex docs? Because we're going to have those conversations with you without a taboo. There's nothing here that's taboo. Come, you talk about it. Let's explore and let's evaluate whether it's mental, physical, or usually both.
Right. And of course, give them the answers and the results that they're looking for. We'll be able to do that. That's great. So next time we're going to talk about treatments.
Excellent.
Are you liking what you're hearing? Do you want to hear more?
Are you loving this great content and do you want to ask us a question?
Please like, subscribe, and comment.
You can find all of our links on our social media, featured articles, basically everything we cover at Linktree at Longevity Protocol Pod.
And if you want to understand and hear a little bit more about our personal lives, follow us on Instagram at The Sex Docs.
Here's where you can comment and ask questions that we will directly answer in our videos.
Be sure to subscribe to our Substack. This is where we get far more information for you, protocols on longevity and health, and definitely the notes for today's episode.
And finally, if you're ready to make a change, a real change in your own life, feel free to check us out at our private practice at hormone-zone.com.